According to the Obesity Medicine Association, the definition of obesity is a chronic, relapsing, multifactorial neurobehavioral disease wherein an increase in body fat promotes adipose tissue dysfunction and abnormal fat mass physical forces, resulting in adverse metabolic, biomechanical, and psychosocial consequences. Abdominal circumference is a measure of central adiposity, which correlates well with metabolic disease risk. Greater than 40 inches is considered to be obese for men and greater than 35 for women. Body composition testing accounts for differences in age, gender, body frame size, and muscle mass. Since the 1970s, the amount of fast food restaurants in business has doubled. 33.8% of the U.S. population is affected by obesity, and 19% of children and adolescents are also affected. Statistics show that there is a heavy correlation between obesity and the fast food restaurants that are now in business. These foods are highly processed, full of fat, calories, and sodium. The general caloric recommendation for Americans is 1,500 to 1,800 per day. One meal from these restaurants equates of up to 1,500 calories. Back in the old days, grab-and-go foods were unheard of. People really had to work hard for their foods, and they usually cooked it straight from scratch, no box mixes or pre-made items. Coincidentally, the obesity rates were much less years ago. Although the spike in fast food restaurants played a rather big role, there is also some correlation with socioeconomic status and the onset of obesity. Individuals with low income have more stress and also don't have the financial means to buy healthier options when it comes to food. Scientific evidence suggests that social class affects health, and the stress beginning in infancy leads to development of chronic diseases. Since its founding, occupational therapy has been a healing profession of practitioners who assist clients, people, organizations, and populations to engage in everyday activities or occupations that they want and need to do in a manner that supports health and participation. Occupational therapy practitioners apply their knowledge about engagement in occupation, that is, everyday activity, to help clients who may be experiencing disease, impairment, disability, dissatisfaction, or adverse circumstances participate in their daily life in a manner that supports their health and well-being. Occupational therapy is a healthcare profession that is qualified to provide interventions with individuals, groups, and society to effect change to promote optimal health. Occupational therapy services often are used directly and indirectly to influence weight management and related health concerns through attention to healthy lifestyle choices and engagement in fulfilling occupations. Obesity is an illness that puts individuals at a higher risk for serious diseases such as type 2 diabetes, heart disease, and cancer. One's diet being the main factor, along with genetics, environment, socioeconomic status, as well as certain medications, all play a role into defining obesity. Making better lifestyle choices is the best precaution to take to prevent obesity. If not, this illness will gradually turn into a disability, leaving surgery as the only option.